Good morning. Okay. Ladies and gentlemen, thank you very much to join us today for this session on the digital transformation of hospitals in Catalonia. We will start with two welcome messages from the President of the Catalan Society of Health Management and also the Vice President of the Catalan Society of Digital Health. So I would like to invite Ramon Cunillera to address the first opening speech. Thank you, Ramon.
Good morning, distinguished colleagues, ladies and gentlemen, friends. As President of the Catalan Society of Health Management, it is a true pleasure to open today this session organized jointly with the Catalan Society of Digital Health and with the precious support of the company Alexion, now renamed as AstraZeneca Rare Disease. Digital health is a new front of innovation for health managers. During the fight against COVID-19, we have experienced the enormous value that digital health technologies have provided to protect health of patients and professionals while ensuring the continuity of care. But we have also witnessed some deficits in our infrastructures and capabilities that we have to address in the upcoming years if we aim to complete the digital transformation of health and care. We know that without measurement, management is only an intuition. We believe that many of the progress achieved in the last 2 years will not vanish, and we can build upon the experience gained. We need to work together to transform health services. Today's session is a good example of the collaboration we need. Health managers and digital health innovation managers debating together about how the health system can support the digital transformation of hospitals and sharing experiences of progress and how hospitals can become smarter. Along this line, the Catalan Society of Health Management launched 1 year ago the Observatory Management Matters to underline how important is good management to achieve good results. I invite you to visit this web, originally named in Catalan La Gestió Importa, published in 3 languages, in Catalan, in Spanish, and in English. The observatory is structured in 9 sections, and one of them is dedicated to digital and technological innovation, where we scan for remarkable and successful innovations that can guide us in our path to transform health services and health management. We need enthusiasm and trust. Transforming to obtain better results, I think, is the golden dream of any good manager. This is not an easy task. We need to work together with enthusiasm, but we also need environments of trust that allow to take risks and when failures are tolerated as a source of learning. As health managers, we know that you cannot change a health organization in 1 year. But when we look back, we realize how our hospitals have changed in the last 20 years due to continued strategic actions. That is why we need a long-term view and more investment. Unfortunately, digital technologies are not cheap. In Catalonia, we have developed a strong e-health infrastructure, and all healthcare providers are already digitized and exchanging data and information through the shared electronic health record of Catalonia. But we must do a step forward and increase the investment in IT, both at central and local level. In this sense, the EU Next Generation funds are a great opportunity to consolidate robust IT infrastructures that will help to improve healthcare operation, transforming the model of care, and supporting clinicians and managers to make better and faster decisions. I wish this session will provide us with insights and open questions to keep this collaboration forward and will fulfill your expectations. Now, I hand over to my colleague and friend, Jordi Martínez, Dr. Jordi Martínez, Vice President of the Catalan Society of Digital Health. Thank you very much to be here.
Hello, good morning, everyone. Thank you, Tino, for your presentation, and thank you, my colleague, and thank you, all of you, to attend. It's fully, completely fully, the room is impressive. So, only a few words to say welcome to this meeting, welcome to this session, and in behalf of Catalan Digital, in English is Catalan Society of Digital Health, and in behalf of Francesc Garcia Cuyas, our president, that is today who cannot be with us. And a few words in order to understand what is the Catalan Society of Digital Health. Was created in 2016. It's a young society. It's under the umbrella of Academy of Health of Medicine in Catalonia. And we created this society because we understood that the changes that we're producing in our environment, introducing digitalization, introducing different globalization, and the universality of the internet. These three issues were changing how we are producing services for our patient, delivering these services for our patient, and we understood that we needed a specific society to put focus on these topics. Only three words about that we do. We have 10 objectives, but today I don't remember the full objectives. Only three. One is we want to be an instrument to introduce the idea of digitalization in each of one society in our Catalan health ecosystem. The second is we have to generate knowledge, to distribute this knowledge, to generate debate about the digitalization. And the third, we want to be a multidisciplinary society. We understand that when we talk about digitalization, we not only talk about technology, we are not talking about only physicians, nurses, we are talking about a plural point of view, and we need to introduce in the same basket different professionals. I think that we have to move to our keynote speaker, because you are waiting for the speaker. Thank you so much and enjoy. Thank you.
Thank you, Ramon. Thank you, Jordi. The idea of the session today was to bring the high-level view on the digital health strategy in Catalonia. We wanted to land it into the hospital sector, and that's why we invited two hospitals to show also their strategy in brief and have a moderated debate with them. But to start to bring this high-level view, we wanted to invite one of the makers, actually, of the digital health strategy, Jordi Piera. He's the director of the Digital Health Strategy Office in Salut. He's the health insurer in Catalonia. So I would like to ask Jordi to join the floor and address the keynote speech that will open the debate afterwards. Thank you, Jordi.
Thank you, Tino, and also thank you, Jordi Martínez and Ramon Cunillera, both representing the Catalan Societies of Digital Health and Healthcare Management, for having me today. And well, I didn't expect such a room full of people. I thought we were going to be like 20 friends, but yeah, that's cool. Thank you for all of you for being here. So, here. My presentation has just, I would like you to leave from here with just three takeovers. The first one is to understand which is the status of the digital transformation here in Catalonia. The second one is to guide you through a reflection process that we did in here that ended up in this digital health strategy for Catalonia. And finally, well, give you some hints about this digital health strategy and how we see the future. So just to start with, and trying to position you for all of you that you are not from here, just some figures or some numbers around Catalonia. So northeast of Spain, 7.7 million citizens, universal coverage funded by taxes, 10,000 million euros budget, maybe more with the COVID. And I think the most important part for this presentation is a very heterogeneous ecosystem of providers with different natures. So different types of legal entities, from foundations to all religious orders, all sorts of different healthcare provider organizations that historically have had the ability to select on their own information systems. I will go into that. This 16,000. I will get you through that later on. But well, just to tell you, this freedom in the selection of the information systems at the hospital level mainly have caused the appearance of many silos of information, and that's one of the things that we want to tackle with this digital health strategy. Along it all, well, almost 1,000 facilities all across Catalonia. This is a view of our digital health platform. So the idea is that from the government, we have been pushing towards having some central services that are common and shared with all service provider organizations here in Catalonia. And this is a bit of the timeline that we have followed over the years. So, and I would like to dig a bit into that. So I would say late 80s, 90s, the first wave of digitalization of healthcare systems, and also the social care part. There it's a bit lower, the level of digitalization. Here there was some sort of competition in between all of these different healthcare providers to see which one was first, so we could digitalize at least the medical records, which were paper-based, very fast into digital. In year 2000, we had the ability to have the unique patient identifier for Catalonia. Then we have our system for electronic prescription, which is shared all across the public service providers in Catalonia, also linked with pharmacies. So in the pharmacy, they will know which is your prescription and you will be able to pick it. A big and important project for us, the shared electronic health record of Catalonia. So in year 2007, it's the year that we started sharing medical records all across the public sector. All service providers are entitled and must share discharge reports, test results, everything that we deem important to be shared to ensure the continuity of care all across Catalonia. This has been shared since the year 2007. It's true that we started with non-structured information, and step by step we moved towards more structured information. Right now, I would say we are at 70% of structured information. In year 2009, we were able to deploy as a subset of the information contained in the shared electronic health record of Catalonia, the personal health folder, it's called Salut, it's the patient portal. We were not very successful with it within the first years. It was very complex to register for it, but COVID has meant a great push for us. So we moved from 400,000 users registered before the pandemic, so March last year, to 4.6 million after the pandemic. We've been somehow forcing citizens to go and use the portal in order to have their vaccination certificates, and also part of the strategy of the bureaucratization of the healthcare system. So being able to renew their electronic prescriptions through there, also the sick leave reports, all of that thing, we've been moving towards there. And well, now 4.6 million users. We also have a care process management tool in order to ensure the coordination and referrals among the public sector. We have deployed central PAC systems for all Catalonia. So now, for digital imaging, not every hospital needs to have a very big infrastructure underneath. So we have a shared one, and we can take advantage, therefore, of economies of scale. And well, as everywhere else, there's been a huge deployment also of the remote consultations, either synchronous or asynchronous. We have more than 12 million remote consultations. This is the same view. I mean, this is, well, an architecture view. What I wanted to show you is that, well, as I think as everywhere else, we are trying to move the boundaries from the inside of the hospitals, inside of the healthcare facilities, towards the home of the patients. And well, the upper part of this slide shows that the part where we are building on the personal health record. And now, well, we are, I would say, we are very happy with the situation. I mean, it's nothing that we can blame about. But this was not enough for us. So we, and it was a very bottom-up approach. Some CIOs from the Catalonian healthcare system started a reflection process, thinking, well, I mean, we're standing here, we've been achieving a lot by sharing these medical records, but there are things that we could be improving. So now I will guide you a bit through the thinking process that we followed. The first thing for us was identifying the hospital information systems as one of the main sources of patient-related information. So one of the places where most of the information is generated. All along, I mean, of course, the medical record and all the surrounding different systems. And I mean, I don't want to go in detail with this, but we have, you know perfectly, the departmentals, we have research data, we have genomics data now, we have all sorts of data that stays in plenty of different silos. And that was one of the major problems that we have identified in here, which is that data is not truly following the patient, but it's buried in plenty of different silos of information. In our case, and that's the situation that we have in Catalonia, I told you we have 71 hospitals, 29 different vendor products, and we did some survey with some hospitals, either big or smaller ones, and we realized that in each of the big hospitals, so in the big tertiary hospitals, we have around 800 different silos of information using different standards. It can be Excel sheets related to research, access databases. It can be all sorts, I don't know, medical devices. All of this is information related to specific patients that does not truly follow the patient, that is somehow, or in the best way hospitals can, integrated with the medical record. Smaller hospitals, 400 silos of information, and according to our calculations, I mean, this is a prospection, we think that we have around 6,000 different silos of information here in Catalonia, which relate to our citizens. And that's one of the things that came out from this reflection process. And all of them, of course, representing these clinical concepts, the same clinical concept, in many, many different ways. So if we take, for example, the blood pressure as a concept doesn't, as a clinical concept, doesn't necessarily stay represented in the same way inside of the same system, and well, within two different systems, it's also very complex. So once we want to benchmark specific clinical process, when we want to follow a care pathway and compare it in between two different hospitals, it becomes very difficult because there's not matching of the semantics of this information that we have collected. that's the result of this first iteration of reflection that we followed. So we have a broad ecosystem of a lot of different applications that have their own data models, their own logic, and that store patient-related information. The solutions or the EMRs, basically they follow, I mean, they are a result of this first wave of digitalization, as I was mentioning before, and they are a bit old-fashioned. We are solving a lot of things with interoperability, and we are happy with it, but it's costing us a lot to maintain all these interfaces, and it's growing exponentially now with the adoption of more and more digital health technologies. We have difficulties to scale up this innovation, so if a certain hospital is able to develop a specific innovation, once we want to scale up this to other hospitals within the system, it means a new integration, even, I mean, new care pathways, new everything, so it's very costly for us, and we think that, well, we are not resilient enough or fast enough to change because of that. So we've seen here that we have a limitation due, I would say, to the legacy systems, to the information systems that we have currently in place. The second part of this thinking process, and this is more generic, I mean, it's not specific to us, we were thinking, I mean, why is that? So why do we have such a problem? And once we look outside, we saw that it was not only us, it was everywhere else that were facing the same problems as we did. So healthcare is one of the classical industrial sectors, so to say, that, well, has not yet fully performed this digital transformation. And we can distinguish here among two groups. I mean, we have this group that we call the first wavers, that they perform the digital transformation very easy and very fast due to the huge benefits that they would find in the internet, especially the industries that benefited a lot from the appearance of the internet. In here we are talking about the travel agencies, we are talking about media, we are talking, well, the disappearance of the blockbusters and all these industries that you know that very fast they move their business there. Each extra unit of their product was costing almost zero, the distribution costs were almost zero. Healthcare, as some other industrial sectors, has a characteristic, which is that this physical dimension, I mean, our healthcare professionals, physicians, nurses, everyone, will always mean something. I mean, we will always need this contact with the patients and between the healthcare professional. So it's a bit trickier to perform the digital transformation in here. This is the results of a survey from the American Medical Association. They did it in year 2016, and then it was refreshed in year 2019. And they asked their membership which were the reasons, because they thought, well, which were the barriers for digital health, or what was happening with digital health. And they had some quite fundamental questions back in year 2016. They were saying, I mean, does this work? Or, I mean, which is the evidence base of this? Or will I receive payment? Or which is the liability? Or, well, whether it will work in my practice or not. So really, there were concerns about whether these different technologies that fall under the umbrella of digital health, whether it works or not. Fortunately, in the year 2019, this was refreshed and the results are better. Now they seem to be more aware, and well, now we are waiting for a refresh of this survey, hopefully after COVID, and I think that, well, the results will be way better. But in year 2016, which was exactly the year that we were doing our reflection process, there were, well, all these fundamental questions, all these 4 fundamental questions that I'm sharing with you. The literature is full of evidence and analysis of the different barriers towards the adoption of digital health technologies. And what we have learned from that is that it's not about technology, it's about culture and about organization. That's possibly the 2 most important barriers. Here you have a survey. That one is from year 2018, and well, still the training of healthcare professionals and ranging from leadership to frontline professionals still is the first barrier. If you check in here, I mean, technology doesn't come until the fourth, which is legacy systems. Well, you won't find technology as a barrier until the fourth one. The second one is organizational silos, so basically being able to change or reshape our organizations. And the thing is that we have tried to, well, I mean, at some point we have tried to do this digitalization of the healthcare system, and we have possibly not thought about the value that the digitalization of a certain specific healthcare process may add. I mean, we need to consider this. I mean, we are not going to digitalize because of the sake of digitalizing or because it must be done now. We need to find the value. Also, we need to find, I mean, to rethink the overall care process and not think about the digital process and the face-to-face one. I think that needs to be substitutive one of the other. And of course, they will obviously be hybrid because we need to guarantee equity and access, and not everyone is able to access these technologies. But we need to think about this. And I think it's quite dramatic. I mean, some surveys and some research says that 40% of the healthcare professionals, I mean, face some signs of burnout due to the usage of technology. So we need to be careful with that. Also, the medical records. I mean, I was telling you, we have this first wave of digitalization of the paper-based records into digital. Possibly we need another iteration. I mean, medical records that free the time of healthcare professionals. Right now, also 40% of the time that professionals spend in the consultation with a patient, they spend it writing things in the computer, and most of the times patients leave the consultation saying, well, this guy has not touched me. I mean, he's been hiding behind the computer. And I think it has, well, I mean, caring and curing this just physicians cure by the sake of touching you. So this is important to be taken into account, and that's one of the things that we learned in this reflection process, and that is part also of the things that we want to solve. This is some surveys on the usage of EMRs and EHRs, international, also the results of a Catalonian one. Not, the professionals are not satisfied with the systems that they are using. And this is a tweet, a recent tweet. I mean, it's from the 5th of October, and I thought it was interesting because this is exactly the representation of legacy systems as they are now. I mean, I don't know how they work. I mean, it must be by a matter of a chance, because once you look or you draw the architecture and the technology and all the integrations, I think it's a miracle sometimes that this is working really, and it's only to us that is happening this. I mean, I think that we need to simplify these infrastructures and rethink, and possibly it's throwing everything away and starting again. That's more or less what we are aiming to do, but as you can imagine, it's not easy. So we came with, after all this thinking process, we came with this digital health strategy for Catalonia. It's a plan, as I told you, that was very bottom-up. It was a group of CIOs that started pushing towards this. We built it around the strategic plan of the Catalan health, of the Catalan Ministry of Health. And we took the chance that there was a strategic line in there that was called Digital Health, so we built it inside of there. It comes subscribed by more than 300 professionals all across the Catalan healthcare system, from frontline professionals, CEOs, CMOs, everyone somehow, or we involve as much people as we could, in order to gain acceptance of the plan. We wanted in here, as you can imagine, we wanted to push for this model, patient-centered, with a strong focus on data. We wanted to establish some sort of governance around information systems, because I was telling you before that every other healthcare organization could do more or less whatever they wanted. We wanted to ensure a financing framework to move our ideas forward, because if you don't have the money to do so, well, it's difficult to do such. We wanted to foster innovation, so we wanted really to unlock our systems for innovators, startups, to be able to develop systems on the top of ours. And as you can imagine, as every other strategic plan, we define a roadmap towards achieving the goals of the plan. We ended up with 15 different strategic lines that more or less aim to cover all the challenges that we are facing here. I would say that the most important, I mean, all of them are important, but I would say the most important for us are the first two vectors, which is this building of this new EHR for Catalonia, that for us is somehow the central piece of all the strategy, because we think if we control this patient-related information, we will be able to improve our system. But there are other things. I mean, with, as I was mentioning before, the lack of skills of healthcare professionals, it's a barrier that we identified. So we are working on a plan towards developing the workforce with digital and analytical capabilities. Going into this central piece that is the most important one for us, so this unique electronic health record of Catalonia, for us is the, I would say, technical and functional repository of all the patient-related information in Catalonia. And, well, we really want to dig into that, and we really want to take systemic advantage of this patient-related information and really be able to break all these silos that I was mentioning before. We follow this paradigm. I mean, this is some words from Rachel Danscombe from NHS. She's currently the CEO of the Digital Academy in the NHS, and it's that data is for life. I mean, not for just for one system. So we want data to follow patients, more or less. And I don't want to go technical with this, but I think that this represents very well the approach that we want to follow. So currently we have many different applications that have their business logic, the data models, and the user interface and user experience buried in there. And we try to merge the information that is contained in there through interoperability. And now we want to move towards the thing that you have in your right. So basically, a central data where all the applications and services build around. We have designed the project in a way that is not that does not foster our thinking. So we think that this project can help us trigger a reflection on the healthcare delivery model. So basically, we don't want to follow the same model that we have now, which is very vertical from the classical healthcare level. So you have primary care, you have specialized care, you have intermediate care. What we want to have now is this longitudinal view. So the programs that are helping us doing this reflection are helping also us to discuss on the healthcare delivery model and giving it a longitudinal view. So we want to talk about outpatient, and when we talk about outpatient, we are not just talking about the things that are happening in primary care, but also at the home of the patients, also at the outpatient consultations, in hospitals, day hospital, everything that is happening outside of the hospitalization unit. And well, proceeding in such a way, we are doing the same. So the programs have been designed for this purpose. The project is 40 million euros for 4 years of work. We are developing the foundations of this new EHR. We are starting in outpatient, and this includes community mental health, residential care, also integration with social care, and integrating it with the shared electronic health record of Catalonia, which basically has the information also from hospitals, intermediate care centers, and everything. In here, and that's, well, I would say the innovation part of the project. I mean, we could have selected a big mega suite and just purchase this very big system that basically does everything, but which for us would mean a very strong lockout of really being able to control all the system. So we have decided to follow this, what we call this knowledge-driven approach or open platform approach, where we basically aim to build a system that is able to separate from the classical layers of information systems architecture. It's able to separate the clinical knowledge. So basically, what we really want to take care about is of the clinical data models and how we represent them technically in our systems. So really being able to separate the data from the applications. And this is something that we are doing by adhering or by following a standard which is called OpenAir. And Catalonia has shown its interest and commitment towards adhering to into OpenAir. So really being able to separate data models from the applications, because with this we think that data will follow the patient. And we think more things, which are, and this is my last slide. So basically, we are decoupling, or our intention is to decouple the data from the applications and everyone to follow the same data models. We are socializing these data models with everyone, industrial partners or service providers, to share these common semantics. And we think that this will also unlock innovation. For this purpose, of course, data governance is very important, as you can imagine, and the governance of all these clinical data models. And well, we are happy that we have found political commitment towards this. Well, it may sound a crazy idea, but yeah, that's what we are doing. And yeah. And with this, I am done. Thank you for your attention.
Thank you, Jordi. I would like to open the floor if there is any question from the audience that you want to address to Jordi. There is. Please.
You are collecting massive information, amount of data and information regarding the city. I didn't hear anything about your strategy for the data security and basically cyber security, and how this data is going to be protected.
Well, that's a very good point. Thank you for your question. Yeah, I mean, right now we are concerned that we are not doing enough when it comes to data security and all the threats that means, well, storing and having these massive amounts of information. Right now, as I was telling you before, we have this very heterogeneous ecosystem where basically we have plenty of partners or service provider organizations that are holding this data on behalf of patients. And we are, and the service providers are worried because they don't have enough resources in order to safeguard the data. What we are trying to do with this project is somehow trying to centralize a bit these data models and working very close by with the Agency for Cybersecurity in Catalonia in order to protect better our infrastructures. But right now, we know that we are not doing enough because, well, basically, the service provider organizations do not have enough resources to protect their data sources. Mm-hmm.
Are you planning to use this data for research and development also, besides the providers?
Mm-hmm. Yeah, we are using this data for research and development. Catalonia has a very strong plan for sharing this data with researchers all across the public healthcare system and also with universities that are part of the network of research organizations. This is organized through the Agency for Quality Assessment in Healthcare, AQUA's agency here in Catalonia. We have a program that is called PADRIS, and that is providing secondary usage of data. Also, We are working into mapping all of our data models into the OMOP standard, this standard that is promoted by industry for observational studies. We are also working in that. I would say that we have 70% of our data models mapped into this and shared throughout this Padres program. Yes, here we've been working, here in Catalonia we have, which is part of the system and part of the government, it's the TIC Salut Foundation. It's a foundation that manages this strategic line for us on behalf of the government, so they are the ones that are in charge of managing this strategy. What we have done in here is following this paradigm of the so-called federated learning environments where we have built this infrastructure where you can have people that is providing data and standardized. In our case, it's basically OMOP models, but it can be standardized in any other models. And this data is not flowing away from the ones that are providing data into the federated learning environment. And on top, you have an ecosystem of researchers, companies, startups, whatsoever, that they are working in the algorithms and that are able to test them on the top of the data that is being provided by the others. So this is somehow GDPR compliant. Data is not following, flying outside of the systems, and these algorithms can be tested. Right now, for example, just to give you 2 or 3 examples of things that are currently working here, in the entry of the shared electronic health record of Catalonia, so this big repository of information that we have, there's still a lot of non-structured information that is coming in. For example, the pathology reports. We have worked with some university people and we've been able, for these pathology reports, to standardize 16 variables out of these non-structured reports. And basically we have plugged in the algorithm in the entry of the shared electronic health record of Catalonia. So every time we have this type of report coming in, you will structure these 16 variables which can be used for research purposes. This is on the natural language processing side. We also have some predictive models, so we can predict non-attendance to our outpatient consultations with a very high success rate. So we are deciding to whom we send the SMS messages in order to remind them to come for the importance to come to the outpatient consultation. So we are working with this. We have, I would say, a system-wide strategy, but it's starting.
Thank you, Jordi. I think if you have more questions, we can keep them for the debate. So I thank you again, Jordi. You can join with me, and I will open now the 2 more presentations we have. As mentioned before, we wanted to show this strategy, but also 2 examples at hospital level. That's why we invited the Hospital del Mar and Hospital Sant Joan de Déu. Jordi will be presenting Hospital Sant Joan del Mar, Hospital del Mar, but with a different hat. He's the Chief Innovation Officer in the hospital, and we asked Jordi to briefly explain 5 minutes their digital strategy. Thank you, Jordi.
Thank you, Tino. Only 5 minutes? Yeah, no problem. So, could you do my first slide, please? Okay. I don't know if you know where is Hospital del Mar. It's here in Barcelona, and Hospital del Mar is not really one hospital. It's a public consortium with different facilities. We have acute hospital, and intermediate care, and mental health, and it's a great consortium in the Barcelona city. It's a consortium between Generalitat de Catalunya, Government of Catalonia, and Barcelona City Council. So it's this one. Yeah, our claim. Well, first idea is I will not talk. I want to talk only about digital transformation, but also about innovation. We are in the same direction. Innovation and digital transformation. Our claim is from ideas to value. The idea is you have ideas and you have a strategy, but you have to put on the table, to put on the floor, and create add value for the organization and the patient, the citizens, etc. Our main challenges are, you can see in this slide, is 5 prior challenges. And one is the process digitalization. The idea is that we have to introduce technology in the clinical process, in the clinical pathway, how we can transform this clinical process. You have some examples that we are working now in diabetes, in cancer, obesity, etc. With a special focus in pathology, in digital pathology. We have a huge experience in digital pathology. We started a few years ago with digital pathology, and I think we have good experience. And now we are defining the future unit of pathology, because we designed the digital unit, the pathology unit, maybe 10 years ago. Was different. The technological was different, that now, and the process obviously could be different. And we are using the different tools that the market and the government put on our hands. And in the left of the slide, you can see the telecall, the video consulta, the video call that Jordi Piera put in our hands and some months before. But we are also using other platforms to communicate with the patient, and you have the screen that we have in our electronic medical record. We have a special focus on data. From our point of view, the data is the main asset that we have now, and we have a special focus to move to the personalized medicine or oncology precision, etc. And we have different projects on working. We are working in different projects. We are working with OMOP that Jordi mentioned about before, and we have. I think it's a digital twin, clinical digital twin, because we have our system, our electronic medical record. It's called Nhs, and we have a partial digital twin. It's Nhs 2. With we use natural language processing, and we collect the clinical information and put in this digital twin in standards, in OMOP standards. And we have participated in different networks, international networks, to move to include research projects, etc. Some examples we develop with this data. We can introduce algorithms in the clinical pathway. This is one example during the first wave of the pandemic, COVID pandemic. And we are continuously retraining our algorithm day by day. And we are working with artificial intelligence, applying this artificial intelligence to digital pathology. This is our main occupation. How we can transfer the strategic plan, your strategic plan, to our daily problem. And we're working in this way. We are identifying different sources of data and in our micro ecosystem, and how we can introduce, transfer this data, share this data in I don't know, because we are constructing now I don't know, it could be a data warehouse, data lake, or data Pepito, I don't know, but the idea is to structure this data to offer services based on this data for management, clinical management, research, etc., clinical decision support system, etc. The idea for I think that the previous session was about the patient experience. The idea is how we are using the digital transformation to know the digital experience, and how we are using the digital transformation to know more about not only digital experience. We are working in PROMs, in patient-reported outcome measures and PREMs, and we are using different digital tools to put these PROMs and PREMs into the clinical perspective. Another issue that we have to work is with the digital transformation. We need some strategy to do incorporate into the organization different roles that we don't have now, mathematics, etc. And we have to put in our strategy how we can do reskilling and upskilling strategies with our people. This is the last. We are now involved in a new part of the hospital, and this new part of the hospital could be more green, more smart, with more smart infrastructure, as with obviously more digitalization. Thank you very much.
And now I invite Cristina Adroher. She's the Chief Operations Officer of the Cancer Center in Hospital Sant Joan de Déu. Thank you, Cristina.
Thanks. Good morning, everyone. So, first of all, I would like to thank the opportunity to be here today to give some insights on our digital transformation experience in Sant Joan de Déu. So to put this into some kind of perspective, the Sant Joan de Déu Barcelona Children's Hospital began its digitalization strategy in 2009. At that time, the Liquid Hospital project was created, and this was a tool oriented to interact with the patient and their families through virtual interactive channels. And in this context, we created the patient portal. Then the second wave of this digital transformation was in 2016 with an iteration of the Liquid Hospital project. We created a data lake that accumulated data from different information sources of the hospital at the service of professionals. And then the third wave of this digital transformation was accelerated during the COVID-19 pandemic. And when the pandemic broke out, we were developing the Cortex Strategy. This project is based on the idea of a proactive data model in order to prepare the organization in advance for what's to come. So this strategy is based on data intelligence and the implementation of telemedicine. So to effectively implement this digital transformation strategy, we used a three-pronged approach. On the one hand, we have the e-care. The e-care is a project of non-face-to-face care model and consists of a centralized monitoring center for patients. This should allow to proactive identification of critical alerts, which can serve to anticipate and improve the decision-making. So this tool is focused on maximizing the effectiveness of our care. On the other hand, we have the command center. This is a project based on artificial intelligence, which aims to maximize the efficiency of our hospital processes and patient flows, all in real time. And finally, we have the contact center. It offers a multi-channel service that covers different forms of communication between the hospital and the patient and their families. It can be through email, text messages, and any forms of communication. And this project is focused on improving the patient experience. And with this strategy, we have already achieved some benefits. For example, in the case of the ICU patients, we have seen a 14% of reduction of the length of stay. And furthermore, we have seen a 20% of reduction in hospital operative cost of these patients. So in summary, we have seen that the care models are changing dramatically, and we need new predictive models in order to adapt to those changes and to help move from reactive medicine to more proactive and preventive medicine. So I believe that the Cortex strategy, which I explained today, is the best way to do this, And also it's a critical tool to control costs and to improve our outcomes. Thank you.
Thank you, Cristina. And now we have the three panelists. Actually, when we designed the session, we wanted to encourage a dialogue between the two societies, the digital health and the healthcare management society. That's why Jordi, in some way, is representing the technological side of healthcare providers, and Cristina is representing the healthcare manager side of healthcare providers. Of course, Jordi Piera as health authority. So we have here a triangle to discuss about these synergies between strategy and implementation. And we'd like to open the debate with a question that Jordi showed, the ranking of obstacles in terms of implementation and digital transformation. I would like to ask Cristina if, in her opinion, which is your view on the main obstacle for the digital transformation on this ambitious program of Cortex in Sant Joan de Déu, which is, out of these different options that Jordi explained, are organizational ones, the ones that are holding back innovation in the hospital? What's your opinion?
Yes, so in my opinion, the three factors that are more important in developing a digital transformation in a hospital are the following. Firstly, we must have good data governance, that is having the data well structured between the moment it is created, analyze it, and return it. Secondly, it's imperative to do good change management. Most of the critical factors are associated with cultural aspects, with the resistance of professionals to working in a different way. So the benefits of this change must be well explained. And finally, I think that it's essential to find the right professional profiles and to be able to pay them appropriately.
Thank you, Cristina. And Jordi, what's your opinion? Yeah, Jordi Martínez.
Yeah, I agree with Cristina. And maybe when you think about the bottlenecks or the obstacles to introduce digital transformation or innovation, first you think, oh, I need more money to do that. And maybe sure that the funding is a problem to introduce the digitalization, but there are more problems. One is maybe you have the money, but you don't have any tool to contract people or to contract enterprises, because our regulatory system in the public system, I am talking in public system here in Catalonia, you are under some laws that it's difficult to contract to startups sometimes. No? But when I think more, maybe from my point of view, if I have to choose one problem, one obstacle, is you need to identify a leadership. A correct leader in the organization. At this leadership, for sure, you need leadership in the bottom of the organization. But do you need to identify a leadership in the top of the organization with executive capacity? You have to put this issue in the C-level, and sometimes we don't do that.
Let me challenge then Jordi Piera on this particular element, because this is clearly a non-technological obstacle. The digital health strategy goes beyond the technology. From the health authority, how do you encourage to increase the leadership of the health system towards digital transformation?
Yeah, that's a good one. Thank you. I mean, I'm quite, and it was in one of my slides, I'm quite obsessed with the capabilities or the competencies of healthcare professionals, including managerial structures. I mean, this is something that it's been identified by other healthcare systems. We know that the guys in Singapore have identified this and they are tackling it. We know that in the UAE, they are putting a lot of focus in the workforce development. And also the NHS, which is a system that we try to, well, we use it as a mirror very often here because they are also a beverage system, blah, blah, blah. They have set up this digital academy where they are training leadership at the level of the organizations to start having these capabilities. The Nhs Digital Academy trains every year a cohort of 100 professionals. It's a competition among them if they want to be part of this. And they have massive amount of inscriptions. They have put in place a one-year program, which is not so stressful as doing a full master's or stuff such as this. And they are currently training the 4 cohorts, so the group of people that will make the 400. I think that giving this leadership of our healthcare organizations the appropriate tools to understand the digital transformation will make emerge these possible leaders and then, well, things starting to happen afterwards.
Thank you. Moving to innovation, in your strategy, Jordi, Piera, we can see that it's a long-term plan, but at the same time, you have to coexist with short-term developments. On the other side, we have heard from Cristina and Jordi that they are developing new local digital strategies. How you combine the innovation of these, let's say, front runners with the overall strategy? Because it looks like you can diverge in directions.
Yeah. That's also a difficult one. I mean, our project, as you mentioned, it's truly being able to clean some of the dust that we have hidden under the carpet. And to say in some way, I mean, all these legacy systems, all these layers and layers of software, one on the top of each other, just adding some fancy interface to the previous old technological thing. And well, this is tricky and will take time. And of course, we need to keep showing that we are advancing, into this. One of the things that I am trying to push, and I also think that it's possibly one of the biggest barriers, is to keep fostering that healthcare organizations do not stop doing innovation, is to change the financing system. I mean, right now, we should not fool ourselves. I mean, we are still paying for hospital discharges. We are still paying for the amount of emergencies. We are still paying for... and organizations, well, they have the tendency, and it's the correct one, to organize themselves in the way you pay them. I think that we should move from paying for these activities that I think that are old-fashioned and start paying for value and really being able to identify value will be the thing that will continue fostering that healthcare organizations do innovation. But I think that would be one of the, possibly the biggest catalyzer that I can think of to foster innovation in our healthcare system.
And I would like to hear from the technological side and the managerial side in terms of being supported by the health authority to keep innovating. Which is your view, Jordi?
Well, I agree with Jordi. The financing system is not appropriate to introduce innovation in our hospital and primary care facilities, because basically we are paid by activity, and when you have your meeting with your CEO, with your chief executive officer in your hospital, and we need more money to put in this. You need a minimum investment before you have your return of investment, and where we have the money, the budget to do that. And I think it's true. For sure, it's true. But maybe we need to have I love your strategic plan in ICT and for Catalonia. But maybe we need an operational plan. Why? Because sometimes we have a gap between the real life and the strategic plan. And if you introduce a specific budget with a specific operational plan of how to put on the floor this strategic plan, could be. I mean, maybe we need some standards to standardize some ways to apply this strategic plan.
Cristina?
Yes, I agree with you. And maybe from my point of view, the Catalan administration can help to overcome this kind of difficulties, maybe in 3 ways. The first one, by selecting and promoting projects that are aligned with the administration strategy. And second, by helping to scale up the projects that have worked well and have had good results in an institution to other organizations in the system. And third, by guiding in the evaluation process of these projects. So this will allow the institutions to have reliable and comparable results and between them. So I think that maybe this could be.
Thank you, Jordi. And I will open the floor.
Yeah, just one thing to reflect on what Jordi mentioned about having some standard, some definition of which is the standard to connect somehow with us. We are working now. I told you that one of the goals of the plan is establish some sort of governance. I was mentioning that service provider organizations have had always the ability to more or less do on their own, and that's perfect. I mean, it fosters innovation, and of course, we don't want to hamper this. But we want to avoid duplication of efforts, of resources, of technological infrastructures. We are trying to establish this governance. So we are working now. Going to your standardization point, on a framework which has 4 dimensions for every other project that is happening within the public healthcare system in Catalonia that is willing to somehow interlink or integrate with the digital health platform. It is for the 4 dimensions that every other project needs to fulfill. One is the regulatory and security aspects. And we are working here with the Agency for Cybersecurity, with the Data Protection Officer, on which are the rules for every other project that they need to fulfill to link with us. Second is the technological architecture. And in here, what we are seeing is how do we link the possible technological components that these projects may have that link with the roadmap of our components, so we don't duplicate efforts in that sense. There's a third dimension, which is I would say the user interface / experience, which is we cannot have our citizens and professionals jumping from one platform to the other. I mean, we should have some standard view for them to just think that they are in the same, promoting things such as the single sign-on for the personal health folder, that they don't have 1,000 apps that they need to jump from one to the other, but making the personal health folder as the main entrance and giving all the applications some similar look and feel, that they feel that they are inside of the Catalan health system. And the last one, which is the one that I like the most, but maybe it's not so sexy, is the one on data. I mean, all the part of the data models, the information model, and really all these applications or different digital health solutions fulfilling the definition of our clinical models, because at the end, this is what will allow us to take systemic advantage of this patient-related information and data following the patient. So that's the last dimension. We want to know which is the data that is being collected by this specific digital health solution, and the solution to follow our models, so it's standardized. So that's we are working in this. It will be published before the end of the year, and it's a way that we think that will help to just put some order into these new developments.
Perfect. Questions here. Wait a second, just to have the microphone.
Thank you. It was a very interesting session. So I'm Bruno Messen. I work for the World Health Organization in Geneva. I work in health financing, and I think we share some issues with digitalization. It's, well, we have to work with legacy when you build, well, at WHO we have a quite clear vision where to go with national health financing system, but we have a legacy as well, many schemes and so on. And I even think that your problem is even bigger because it's not only legacy, you have also this uncertainty about the future technological development that nobody can really predict. So you must create something which will accommodate that, and you must keep things running now. You cannot say we will building something new and wait for 2 months. So it's even worse, more challenging and worse than for health financing, I would say. At WHO, we feel that it's quite clearly nearly impossible to give advices to countries on how to say, oh, you should do that in a very specific way. Each context will be different. And so what we have produced is what we call the health financing progress matrix. It's a list of principles. We know that if you fulfill these principles, you go in the right direction. And I wonder whether you don't need something, well, the digital health financing, digital health community does not need something like that, actually. It's because we have the big plans, but we know that many things can go wrong during the journey. So maybe we need principles. We know that when we check them, we are making steps in the good direction. And then the evidence base should focus maybe on validating these principles. So I don't know if it makes sense, if you want to react on this point. Over.
Well, I mean, yeah, it makes complete sense, and would love to hear more, more about this. I mean, anything that help us move towards that direction, it would be helpful. I mean, there's been some bold movements, and I think that all of us that work in health or in digital health, we know the movement that minister in Germany did in order to try to include apps and digital therapeutics and all these sorts of solutions, and it seems that it created a movement in Germany. Now there's been an announcement from Macron, I think, that he says that he will copy the thing that the Germans did, and I guess that it will move all the machinery in France towards this. And well, once we don't lose from sight that when Germany and France move, well, all Europe shakes at least. But yeah, I mean, I agree with you that every other country is a different reality. Here I mean, Spain, it's 17 or 18 or 19 or I don't know, 20 different healthcare systems. And I mean, there's not the magic recipe to fix that, but we'd love to hear about this model that you are mentioning and see whether it can be applicable in our reality. Yeah.
Any other question? No? Yeah. Here.
Thank you. What are you doing, or how are you tackling the problem of patient lack of knowledge on digital tools?
The problem, your question is about the how, not the problem with the knowledge using the digital tools, the patient. Yeah, it's my personal opinion. I think when you have problem with patient using the digital tool, it means that the digital tool is not correctly developed, because the user experience and how the user are using this tool could be embedded in the development of this tool. And when we modify processes, or when we decide some specific tools to contact with the patients, we put into the decision, in the decision of the solution, that identifying the needs, etc., the patient. This is the idea. And in our hospital now, we have a specific solution that I don't remember now the name. That the idea is that we have a patient's academy to improve the skills and digital skills and competencies in this with these patients. But we have a name, but I don't remember exactly the name. Yeah. If I hear you, it's elderly people?
Elderly people, yes, and chronic disease management chronic disease patients that have a lot of connection with healthcare services, but they have a lack of knowledge and understanding.
Yeah, absolutely, absolutely.
Thank you.
No, it's no. With the elderly people, is in the same way. Another idea is you never have only one tool for all the target. You have to specify for a specific target a specific tool.
I would also like to reflect on that. I think here, and we agree, and we have also studied this. Of course, the level of acceptance and the level of literacy of all citizens is not the same, and we analyzed this recently for the e-consultation, so the asynchronous messaging with primary care physicians. And we realized that the most amount of users was more or less healthy people, young, working, with no major chronic diseases that just wanted to do fast their interaction with the healthcare system and just live fast. I think that once we design all these new care pathways that are being enhanced by digital health technologies, we should guarantee all the time, or we should always have this in mind, I mean the levels of literacy, in order to guarantee the accessibility of all citizens to the services and not causing inequalities. Here we have the department of, which is the regional ministry of digital policies, developed a framework to assess the levels of digital literacy of citizens. It's called, it's a questionnaire called ACTIC that it's being used in some hospitals and in some healthcare organizations when designing these services to check whether patients are candidates for this technology or would be out of scope due to their level of literacy. But I think here the important is being able to design the services bearing in mind that we will have, at least for some years, patient profiles that won't fit this pathway, totally digital, and have an alternative solution for them.
Thank you. If there is no more questions, we can close the session. I want to thank you all presenters for their messages and views, all of you for participating in this session, and of course both societies, Digital Health and Healthcare Management Societies, to organize this meeting supported by Alexion. Thank you very much and see you soon.